In this video, we will try to explain in a maybe too simple way what happens in a panic attack and how you can handle the attack. Let's first agree on the fact that panic attacks are real, painful, and frightening. So, first, we look at some known facts about panic attacks. Overall, the physiological reactions that occur during a panic attack are a normal response to perceived danger. However, when these reactions occur in the absence of actual danger, they can be distressing and uncomfortable. During a panic attack, the body's physiological reactions are triggered by the activation of the sympathetic nervous system, which is responsible for the fight or flight response. This response is designed to prepare the body for perceived danger, and it can lead to a range of physical symptoms. Some of the physiological reactions that can occur during a panic attack include rapid heartbeat. The heart rate increases to supply more oxygen and glucose to the muscles and organs. Hyperventilation. Breathing becomes rapid and shallow, leading to a decrease in carbon dioxide levels in the blood and an increase in oxygen levels. Sweating. The body sweats in an attempt to cool down and regulate body temperature. Trembling. The muscles may tremble or shake due to the release of adrenaline and other stress hormones. Dizziness or lightheadedness. Blood vessels dilate to increase blood flow, which can cause a drop in blood pressure and feelings of dizziness or lightheadedness. Nausea or stomach discomfort. Digestion slows down during the fight or flight response, which can lead to feelings of nausea or stomach discomfort. Chest pain. The muscles in the chest may tighten or spasm, leading to feelings of chest pain or discomfort. Tingling or numbness. The release of stress hormones can cause a tingling or numbness sensation in the hands, feet, or face. The tricky part is how to deal with the attack. As you can imagine, there are lots of good advice. In this part, we will look through some of them, and at the end of this video, we will give you a technique that has proven very effective in controlling and stopping panic attacks. The normal advice is divided into the following points. 1. Breathing. Taking slow, deep breaths. Inhale for 4 seconds, hold for 2 seconds, and exhale for 6 seconds. 2. Focus on the here and now. 3. Progressive muscle relaxation. A process where you tighten and relax muscles, starting at your feet and working your way up through the body. 4. If you are connected to cognitive behavioral therapy, CBT, the action is to identify and change thinking patterns. 5. Taking anti-anxiety medication. 6. Exercise to reduce stress and anxiety as a substitute. 7. And last but not least, seek professional help. When a person experiences an anxiety attack, the person's focus goes almost automatically to the feelings, the physical sensations, and ultimately to the possibility of death. Earlier, we explained that the physical reactions often come in connection with breathing, heartbeat, and the feeling of being uncomfortable. The focus on the sensations create a sort of circular reference between the brain, the glands, and the physical symptoms, where each part makes other reactions stronger. An escalation like this is very unpleasant. One way to control and reverse this series of reactions is to do a several-step protocol. Step 1. Observe the physical sensation and place it in the area where it is strongest. For example, restraint in breathing can be about a tightening around the chest or a tightening around the throat. Step 2. When you have located the affected body part, try to give a form to the sensation. For example, pressure in the chest might be seen as a rock, a ball, or a belt. It does not matter what you describe it as, just give the sensation a form. Step 3. Give the form a color. Just think of the form that you have imagined and pick a color. Again, no right answers, just do it. Step 4. Give the form that now has a color, a size. For example, big, broad, slim. Now go back to step 1 and ask, has the location changed? Go to step 2 and ask, has the form changed? Go to step 3 and ask, has the color changed? Go to step 4 and ask, has the size changed? Take a mental note of the changes and then start over. Go back to step 1 and ask, has the location changed? Go to step 2 and ask, has the form changed? Go to step 3 and ask, has the color changed? Go to step 4 and ask, has the size changed? This might seem as a strange way of getting rid of a panic attack, but let me explain a little bit. When you experience the attack, you are caught up in the feeling of fear, the sensation of your body reacting, and the underlying prediction of doom. What you will do with this small exercise is to observe the attack and the effects it has on you. And even though there seems to be little difference in these two, experience and observe, you actually switch between two parts of your brain. When you experience, you use your emotions, your feelings. When you observe, you use your intellect, your reasoning. And the funny part is that when you observe, and thereby reason, your experience and your feelings cannot be maintained. Conclusion: the panic attack is history. And that is the end of this video on panic attacks. If you have questions or comments, please let me know. And don't forget to like and subscribe.